no, you can.
That hand shot right up.
You can go.
So stand on up. What I'd like to start with is just seeing the way that you move. Now you said you have some.
So it's lower back pain, and then I feel something like in this area, the
Okay.
lower back.
Does any of it go down the leg any further than that, or is it just kind of starting
No,
to
but
creep into
like
the
sitting in that chair, which was like very uncomfortable. You just feel it on both
Unfortunately.
sides.
Yeah,
Um,
just like across the back and into the hip.
yeah, it's like right at the top of the buttocks,
Yeah.
right across.
What
But the
generally?
muscles, these muscles, I can feel are like really tense.
Yeah. What generally makes it better or worse? Is being
Doing
standing. I was gonna ask, are standing and walking something that you would do to relieve, or would you say?
Usually
you
when
have
I
different
aggravate it,
techniques?
I just go and sit in the most comfortable chair at home.
Okay. The
You know,
sitting takes it off.
Yep.
Being on your feet too active brings it on.
Yeah, because then it just, I don't know, it just,
Yeah. Well, let's take a little bit of a look. I will actually, if this hallway's free, I'm gonna just take a look at the way you walk. That can give me some insight into the way you're moving. This will be just really quick, so if you can't see, that's just fine. I'm gonna have you just walk down to the end as you normally would. Try not to change anything for me, and I'll just kind of talk out loud so everyone else can see what I'm seeing, but you get very little rotation through your trunk. You're pretty rigid as you're walking. And that can be a compensation as a result of the pain. It also can be a contributor to the pain.
Mhm.
So you look at all of these findings as a possible cause and a possible compensation. So what I'm going to have you do is move through some range of motion. First, reaching forward, kind of bending, and let me know what you feel there. Tightness in the back,
tightness
back of
here,
the legs,
tightness here.
and come back up. If I asked you to put your hands on your hips and bend backward for me, what does that feel like?
So I can feel like a pain like right at the bottom.
Increases your pain.
It don't really increase the pain, but now I notice a pain like at the bottom of my spine.
Sure. More from bending backward
Yep.
than going
You know,
forward.
and then there's still a slight pain here.
Yeah, so you seem to have that preference where flexing feels good, extending or being upright doesn't feel so good.
Mhm.
I'm gonna have you bend to the side. Does that change anything?
No.
To the other side. A little stiffer there.
Mm-hmm.
Does that change anything? Or just stretching?
Just stretching.
So I think what we'll do here, I do like to get a little bit of a look at the hips, especially because that seems to be a contributor. Sophie, would it be possible to get this
Out
just
more?
like a couple inches away from the wall?
Yeah, absolutely.
Alright, and I'm gonna grab a pillow. That's just fine.
Do you want the other side out a little further?
I think it'll be just fine.
Perfect.
So we'll have you laying on your back. And from your back here, I'm gonna check out how your hips move. Just try to relax and allow me to move you. I'm stronger than I look.
Mm-hmm.
Let me know if anything changes your pain or if it feels like a big stretch.
So like right there, you know, everything down there kind of
Starts
relieved.
to relieves things to flex,
Mhm.
which is consistent with how you were moving and standing too. How does that feel?
kind of relieving. But then you feel everything down in your leg muscles.
In the knee?
Not in the knee, just basically.
Stretching.
Yep.
Yeah. Painful stretching or just kind of hasn't moved that way in a while?
Hasn't moved that way in a while.
Good mobility here, but your flexion and your external rotation are pretty tight.
Mm-hmm.
So that would be an early on course of treatment. Do you notice in your hips, you may have said this, is it more on one side than the other?
Lately it's been the left.
Okay. Let's anything for you. This side
No.
seems looser.
Yeah.
Relieving, aggravating, or just stretching?
We're leaving, you know, down to the lower part again and
Yeah,
more
just a good
stretching.
stretch. This one's tight too, but not quite as tight as the other side.
Mhm.
Still just good stretching here.
Yep.
And just good stretching there. So, I think a really great place to start for someone like you is with a long axis distraction, which is a form of joint mobilization that kind of works on the hip, but also secondarily helps with the back. Also can affect the knee a little bit, but primarily we're targeting the hip and the low back with that. And let me see if I can get my hands on a towel. I think we have some right in here. Maybe. In here?
I got it. Large one?
Just, yeah, the white face towel.
Yep.
Alright. So lots of different approaches I would take with someone like you, and for the sake of the 5-minute miracle, we'll focus just on the hips, but treatments, yeah, just the size is good.
Right.
Thank you. So, okay. So, what I'd like to do is slip this under this knee. So what does your pain stop you the most from doing?
Keep going. You know, like this weekend I was doing stuff and then it, you know, it just gets to a point where it's like, I just
Just
better
need a
stop, I just better
Yeah.
stop and
Mind if I slip this shoe off?
yep, that's fine.
Mostly those upright physical activities though. And how long have you been dealing with this?
Well,
few years.
quite some time, yeah.
Yeah. Was there ever an injury to the back, or it just kind of came on gradually?
No, I just think in my younger years I always overdid it, and you know that I'm getting older and stuff like that. I'm trying to start to think a
Catching
little
up to
smarter.
you. So, I want this to feel comfortable everywhere, including my contact at your ankle, your knee, your hip, your back. What I'm going to start with is just that kind of gentle pull. You can gradually progress a little firmer. And what I'll do is kind of play around with a couple different angles. This is that long axis. What are you feeling there? This kind of gentle stretch.
Yeah, I mean, it feels like relief.
Good, good. That's what I would expect and hope for. So,
So it's kind of like what they used to call traction in the hospital.
so it's a form of tractioning. And with this, we can be a little bit more specific, but I think it's a great place to start, right? So, we like to look at a really comprehensive approach to all of this. And the first thing we want to do is calm things down. We want to get them feeling better, we want to get them moving better, and then we want to progress to build them back up so that they're strong. But yeah, some sort of traction is often a really good place to start with back pain like yours, because it just kind of, it offloads the spine a little bit. It stretches that hip joint capsule. We know things are tight. It gets things moving a little better, and it stimulates all these neurophysiological effects that are probably more sciencey than most of you care to know today, but it triggers a lot of processes in your body that promote healing and make things feel better. And that's the goal of a lot of our manual interventions is get things calmed down and feeling better so that you can do the things you want to do. How's that feeling with time? Still good intensity, not too much?
Mhm.
And then my line of pull can determine how much we're affecting your back or your hip. So when I'm here, probably a bit more into your back. As I come out this way, may affect the hip a little bit more. Yeah?
Yep.
So it's very,
That exercise is good for the sciatic nerve too.
it's great for the sciatic nerve, yeah. So there's a lot of different joint mobilizations that we can do, and it's all individual. It depends on what your problem is, how your body responds to it. There's not a one-size-fits-all cookie-cutter exercise that everyone with back pain should do. If there were, either I'd be a millionaire or I'd be on the job. Let's get you sitting up. So I want you to notice, and we did just do that one side. In a longer treatment, we'd probably treat both, but I know that was your more involved side. I'd like to see how you feel, just kind of moving through that hip. Maybe we try out.
I mean, it feels better just with that.
Just with that
That
5
little-
minutes
that
of
little
pulling.
5 minutes.
Right, so imagine
It's a miracle.
you do. It's a miracle, look at that. Thank you for volunteering,
Yep.
and you can have a seat.